Hello guys, hope you're all okay. You're all enjoying your life and you're also enjoying watching my videos. You're also enjoying practicing radiology and ultrasonography. I'm Dr. Arshad Nadeem Awan, and as you all know that these days I'm discussing about the musculoskeletal abnormalities. Before going to talk and start the new topic, I would like to say thanks to Y Stylo. This video is sponsored by Y Stylo. It's a company and it's dealing with the stuff, clothes, with the jewelry and with some electronics. Today that the beautiful blazer I have worn, it has been gifted by the Wise Stylo, particularly for the promotion of their stuff. So you must go, and there is a down link. You must go for there. It's worth buying from there. It's really offering very beautiful stuff. So far this lecture is concerned, today I'm going to talk about the x-rays of the lumbosacral spine. When you do lumbosacral spine, that's particularly for some reason. Sometime you pick the renal abnormality, sometime you pick some other source muscle abnormality, some time you may pick on that lumbosacral spine related to the vertebral abnormalities. But these LS spine also give you some systemic abnormalities, some information regarding the systemic abnormalities, like the end plate vertebra. It appears abnormal in certain systemic abnormalities, like in osteoporosis. There will be a fish form or fish type vertebra. If the patient is suffering from the renal disease or renal failure, so there will be a renal osteodystrophy, and you will be able to look for the Ruger jersey spine. If the patient is suffering from the Paget's disease, so there will be a picture frame vertebra. There will be also, if there is some other congenital abnormality, you may find the like a butterfly vertebra. There will be a H-shaped vertebra. There will be Wimberger sign and so many other, like limbus vertebra. So all these information has been included in this video. You will see the picture, you will see the image, and you will see the narration, and hopefully this will help you to understand which type of a vertebra is related to which sort of a disease. So let's start watching this video. Vertebral end plate abnormalities, representing certain abnormalities, may be of local type, or most of the time it would be systemic abnormalities, can be predicted on the vertebral end plates. The one most important one is Cupid's bow vertebra. Here on this image you can appreciate this Cupid bow vertebra. So far its cause is concerned, it could be considered as a normal variant, and the location would be 3 to 5th lumbar vertebrae would be involved. Here on this image you can appreciate two parasagittal posterior concavities can be seen on the inferior aspect of the vertebral body. So this is an AP view, and on the AP view very clearly Cupid bow vertebra can be seen, and this would be considered as a normal variant of the vertebral end plate. So vertebral end plate abnormalities sometimes gives rise to a particular appearance which is termed as fish vertebra or fish mouth vertebra. Here on this AP view you can appreciate and the black arrow is beautifully indicating the fish mouth or fish vertebra. So this is actually the end plate abnormality, and the both end plates become sclerotis and slightly inverted. You can appreciate that these both gone invertedly and to giving or producing a particular type of appearance, and that appearance is termed as a fish vertebra. There is a differential for the fish vertebra if you come across on AP lateral images. Fish vertebra or fish mouth vertebra can be seen in osteoporosis, can also be seen in senile or elderly patient, and it also be seen in those who are taking high doses of the steroids. But the differential diagnoses include osteomalacia. It can be seen in Paget's disease, in hyperparathyroidism, Goucher disease with biconcave vertebra can be seen, and in bone sclerosis can also be seen. So this is the differential diagnosis for the fish vertebra. If you see fish vertebra on the AP view, so you can think of all these diagnostic points and correlate clinically for the finding and for the diagnostic purpose. Another end plate abnormality is wedge-shaped vertebra. In wedge-shaped vertebra, there will be interior border height reduced by 4 mm compared to the posterior border height. Here you can see that the interior border height is reduced compared to the posterior border height. So this is called as wedged vertebra, and this type of a vertebra can also be seen in osteomalacia and in Paget's disease and in osteoporosis conditions. Another particular type of vertebral end plate abnormality is pancake vertebra. Pancake vertebra, what happens with that, there would be overall flattening of the vertebra. The vertebra would be completely flat, and that would be called as a pancake vertebra. And this pancake vertebra is also seen in osteomalacia, in Paget's disease, in hyperparathyroidism, in Goucher disease, and some other sclerotic bones abnormalities. Here on this image, this AP view, you can appreciate the H-shaped vertebra. The H-shaped vertebra is caused by compression of the central portion from subchondral infarct. It usually seen in subchondral infarct caused by either sickle cells and other anemias and Goucher disease. But here on this AP view, you can appreciate that there is a central portion has been compressed, and this central portion is because of the compression of the central portion, this vertebra is giving rise to a particular form of H, which can be seen in sickle cells and in other anemias, and in Goucher disease you can also see the H vertebra. On this lateral view graph, you can appreciate vertebral abnormalities and showing a very characteristic appearance. This is called as humoral nodes or cartilaginous node. Actually, what happened is intraosseous herniation of the nucleus pulposus at the center of weakened end plate. Where the end plates becomes weakened, so interosseous herniation take place of nucleus pulposus. So far its causes are concerned, it causes contain Schwarman disease. It may be caused by trauma. In some time in hyperparathyroidism, these humoral nodes can also be seen, and especially in osteochondrosis there will be presence of the humoral nodes on the X-ray images. A characteristic end plate abnormality is butterfly vertebra. Here, very beautifully image is beautifully shown in this image. It's a look like a vertebra. It's look like a butterfly vertebra, and this is actually a congenital defect. Congenitally, you will see that the vertebra will appear as a butterfly, and there will be a ring epiphysis, a very classical appearance, and I'm sure you will not miss that on AP radiograph. It can be easily seen. Some of the abnormalities can be picked on the lateral, but a few example on the AP laterals are more clear rather than the lateral. So far the butterfly vertebra is concerned, it can be seen on the AP images very beautifully. Limbus vertebra is actually an interosseous herniation of disc material at the junction of vertebral body rim of central and end plate, anterior superior corner. It's very beautifully explained. Limbus vertebra can be seen. this is what look like there is a some fracture. This is not the fracture, it is but actually intraosseous herniation of the disc material. So the disc has been herniated in the body of the vertebra, and on the lateral view it looked like something, a small piece of the fracture piece is detached from the vertebral body. Actually this is not the fracture vertebra, this is called as a limbus vertebra. Rugger Jersey spine is actually horizontal sclerosis subjected to vertebral end plate with intervening normal osseous density resembling the stripes on a Rugger Jersey. And look at this is what the Rugger Jersey spine is. You can appreciate that the horizontal sclerosis, not the vertical sclerosis. Vertical sclerosis is give rise to another particular appearance which I have mentioned in the previous images, that is called Cartwright appearance, but this is actually Rugger Jersey. In the Rugger Jersey there will be a horizontal sclerosis subjacent to the vertebral end plates, and the reason for the Rugger Jersey spines are hyperparathyroidism and myelofibrosis. In the myelofibrosis and hyperparathyroidism and in the chronic renal failure, you will see this particular appearance. It will be called as a Rugger Jersey spine. Picture frame vertebra, it will look like as it's a picture frame, a very picture frame type shape you can appreciate on this images, and this images is actually taken from a patient who is suffering from the Paget disease. So this is the characteristic of the Paget disease. This will appear on the chest, on the lumbar radiograph, lumbosacral or thoracolumbar radiograph, and the appearance of the vertebral body would be like as if it is a picture frame. So this is called as a picture frame vertebra, and this is the characteristic of the Paget disease. On these images you can appreciate a sandwich vertebra, or it is also called as hamburger vertebra. And what happened with that type of a vertebra is, here you can see on the images as well, sclerotic end plates alternate with radiolucent mid portions vertebral bodies that would be giving rise to a particular shape of the sandwich vertebra. Sandwich vertebra having its own particular causes, especially this can be seen in osteopetrosis, and the another differential is called as a myelofibrosis. So in these two conditions, sandwich vertebra can be seen.